Okay, so good afternoon, one and all. I welcome you all for this webinar about the FRCS examination, everything that you need to know. First of all, to introduce myself, I am Manikandan Kathirvel. I am I'm one of the HPV liver transplant consultant in the UK, and I'm also the program director for the PrepMedico Prep FRCS, which is a team of 15 surgeons in the UK, and we have been running training programs for both the JCIE, which is the UK-based FRCS exams, and also the international FRCS exams. So today's meeting is mainly to give an overall picture about what is this FRCS exams, what are the various types of FRCS exams, what is the eligibility criteria, etc., etc. Recently, there has been a lot of change in the rules and regulations for applying for this exam. So all those things we will be looking into. I would request candidates here or the visitors here, if you can switch on the camera, if you don't mind, that will be great. And it will be more interactive rather than me just speaking to a screen. Secondly, my overall presentation would take around, let's say, maybe like 45 minutes to 1 hour. If you have any queries in between, please feel free to stop me and ask me any questions. Or else at the end, I have almost like 45 minutes of a discussion where you can ask me any kind of questions in terms of anything. Okay, so let me start my presentation. Okay, can you see my screen? Yeah. Thank you. Thank you. Right. Okay. So as I mentioned you, we are from the team PrepMedico, which is a newly established identity by a old group of faculty members. So we, a group of 15 surgeons in the UK, we were functioning in a different name, but recently we changed our name as PrepMedico in the last 2 months. And we have been involved in training candidates for the FRCS exams, and we are all based in the UK. And as I introduced myself, I am Manikandan Kathirvel. I'm the program director for Prep FRCS under PrepMedico. So today's discussion, as we all know, is about the FRCS exams. So FRCS stands for Fellowship of Royal College of Surgeons. There are 4 Royal Colleges, as we all know, majority of you might know. This is the Royal College of Surgeons of Edinburgh, Royal College of Surgeons of England, Surgeons of Glasgow, and Ireland. So why are we discussing this topic today? Of late, in the last maybe 6 to 8 months, I get, or my colleagues who work here in the UK, we get plenty of inquiries, doubts on these FRCS exams, especially the international FRCS exams, which surgeons from different countries wants to give. Secondly, there are plenty of doubts. Many think that the MRCS and FRCS is same. People don't recognize what is the difference between MRCS and FRCS. People don't know what is the eligibility. And because, as I told, there are plenty of change in the rules recently, we are often approached with plenty of queries. And unfortunately, although all the informations are given in the Royal College website, it is so very confusing, and there are so many links here and there, making the candidate confused. So the whole aim of this presentation is to make things very, very clear, if at all, if you're aiming to give these exams. So as I told, candidates have doubts between what is MRCS and FRCS, who can write. There are 2 types of FRCS exams to complicate the confusion even more. What do you need to have to apply for this exam? And where can you give these exams? What is the exam pattern? what is the benefits of having an UK FRCS or an international FRCS? How is it going to add to your career? And how are you going to prepare? So all these questions I'm trying to address today. So my presentation will go in this order, starting with basics about what is FRCS, your eligibility criteria, how are you going to apply for this exam, and the key difference between the JCIE FRCS exam and the JSCFE FRCS exam. This is the most important and the crucial point which most of the international candidates should be aware of. What is the exam pattern and how is it different between these two examinations? How are you going to prepare? What are the various resources available? How long it's going to take for you to prepare, etc. And finally, what are you going to do after achieving or after clearing your FRCS exams? So what is FRCS exams? As I told, it's a fellowship exam. So like the MRCS, if at all, if you're given an MRCS, it is called as an intercollegiate exam. Similarly, FRCS is an intercollegiate exam. It means, although there are 4 royal colleges, the exam conducted is common for all the 4 royal colleges. And whichever royal college you apply for will give you your fellowship, but it doesn't matter which college you apply for or under which college is conducting your exam. So the FRCS exams is conducted as just an FRCS exams rather than an FRCS exam conducted by this particular college or that particular college. So it is common for everything. Secondly, even if you are given a section 1 in one of the royal college, you can give the section 2 in a different royal college if you want to, and whichever royal college in which you have applied your section 2 exam will offer you the fellowship at the end. So there are 2 parts in the exam which we will come later in detail. So you have to clear these exams. Once you clear the exams, you have to pay an annual retention fee to continue your fellowship with the Royal College, which will allow you to use the post-nominal FRCS along with your degrees. So you all need to understand that FRCS in the UK is a mandatory exam for all the surgical trainees. Okay, so unlike for the international candidates, it's an optional exam just to boost their CV. But in the UK, for a surgical trainee, the one and only exit exam is an FRCS exam. So a surgical trainee, before they finish their complete surgical training, they have to give their FRCS exam, which is the minimum most requirement for them to obtain their CCT, which stands for Certificate of Completion of Training. Once they achieve it, they enter into the specialist register, which is the minimum mandatory requirement for any surgeon in the UK to become a consultant. So this you need to understand. So FRCS in the UK is the exit exam. And as I told, there are 2 FRCS exam, one offered by JCIE and second one is JSCFE. So JCIE is an exam which happens in the UK for the UK trainees or the surgeons who work in the UK and the candidates who want to enter the specialist register. So all these things, anyone who wants to get CCT or who work in the UK or who want to continue their career in the UK as a consultant, they need to give this JCIE exam, which is also called as FRCS General Surgery, but the candidate has to choose their subspecialty. Okay, it's a specialty-based FRCS exam where 45 to 50% of your questions in the section 2 will be based in your specialty. On the other hand, the international FRCS, which is called as the JSCFE General Surgery exams, is purely general surgery and it is not specialty based. And this is not recognized by GMC, if at all, if you're planning to obtain CCT and work in the UK. So as I told, that this is the normal surgical training program in the UK. A doctor who finished his medical school, okay, they enter into the foundation year training, which is 1 and 2, which is equivalent to internship in India or any other country. So instead of 1 year of internship in India, the candidates do 2 years of foundation year training here. Once they finish their foundation year training, if a candidate wants to become a surgeon, they enter into something called as a core surgical training. It's called CST, or then it is called as a core training 1 and core training 2. It's called CT1 and CT2, which is equivalent to a general surgical training in India. So once they finish CT2, they enter into the specialist training from ST3. Okay. So in the UK, the mandatory exam before they enter into the specialist training is an MRCS exam. Okay, and they enter into their specialist training, and they work for 5-6 years here, starting from ST3 up to ST8. And then once they finish their ST8 training, before they exit as a CCT fellow, they give their FRCS exam. So this is the level from CT2 to ST3, they give their MRCS exam, and for finishing their surgical training, they give their FRCS exams. So as we discussed before, JCIE and JCFE both offer FRCS. JCIE is for UK trainees and non-trainees in the UK. And this is the only exam which is recognized by GMC. And this is the only exam where you write FRCS as your post-nominal. Okay. And it is specialty based. JCIE is for international surgeons, and it is only general surgery. And here, after clearing these exams, you, based on the new regulations, you cannot put FRCS in your nominal, but you can put INT.FRCS, which is called as an international FRCS. Now, who can write the exam? Okay, so first I will be discussing about the eligibility to write the JCIE exam, if at all, if you are a non-trainee working in the UK. And next I will discuss for the international surgeons. For JCIE exam, and again this I am quoting only for non-UK trainees, because the UK trainees, obviously they know when they have to give their exams. For non-UK trainees, but you who are working as a specialist doctor or whatever role in the UK, the eligibility is you should have a basic medical qualification which is recognized by GMC or an Irish Medical Council. When I say basic medical qualification, it's your MBBS, which should be recognized. And secondly, you should have a minimum of 4 years of training in your specialty subject. Say, for example, if you are applying for a JCIE FRCS exam with a specialty of colorectal surgery, you should provide evidence that you had worked in the colorectal surgery unit at least for 4 years. Okay, so in general, it will be an equivalent to 6 years. So 4 years of specialty training and 2 years of core surgical training. So from the time you had finished your MBBS, you should have a minimum of 6 years of surgical experience before you think of applying for the exam. And the most important change which has happened last year is MRCS exams is mandatory. Without MRCS exams, so previously, at least until the beginning of this year, okay, so MRCS was not mandatory. Okay, candidates, if they have the above mentioned criteria, they can apply for the exams. But now, without clearing MRCS, you cannot give FRCS exam. And most importantly, you should have worked in the UK at least for 1 year. Okay, and in that 1 year, you should have registered in ISCP. So for people who don't know what is ISCP, ISCP is nothing but a surgeon's training portfolio in the UK, which is nothing but an online portal where you register for yourself and you need to log in everything you do in and day out. For example, today, if you have seen a case and if you have discussed with a consultant, that needs to be logged in as a case-based discussion. If you have obtained some consent for a patient for a surgery, you have to log in that as a consent form. So like that, so the UK trainees have a method of achieving their competencies as they go up in their surgical training. The same thing, a non-trainee in the UK, they should have done for a period of 1 year in the ISCP portal, and there should be evidence that there is a progression in your competency, and it should be approved by your consultants. And if you think you have all these things, you have an MRCS, you have 6 years of training, and you have been in 1 year and have been using ISCP, then you should be eligible to apply for this exam. Before that, you need to get 3 structured references. Okay, so one referee must be, so on all these 3 referees who's going to refer you to the JCIE should be in the UK or GMC or in the Irish Medical Register. Okay, and the principal referee or the chief referee should be your clinical director or the clinical lead. And all 3 referees should have been closely associated with your clinical practice in the last 2 years. So these are the minimum requirements for a referee to give you a reference. Okay, so you need 3 references. The first person should be your clinical director or a lead, and 2 other references should be from the surgeon or the consultants with whom you have been working within the last 2 years. And you need to have a CV in an appropriate design as recommended by the GMC. And you should have an operative summary, which is nothing but your surgical logbook for the last 6 years or 4 years or whatever training you have been. Okay. And an ID proof, which is usually a passport. So these are the requirements for a non-UK trainee in the UK to apply for JCIE exam. Now let us move to JCFE exam. Sorry for the spelling. It is JSCFE. Okay. So so I think this is very important for most of the registered participants here, because I could see many international candidates have registered for this webinar. So how you know that you will be eligible for this exam? Exactly like the JCIE exam, you should have a minimum of 6 years as a qualified doctor. Okay. And then again, MRCS is mandatory. This was a recent change which was brought in last year. Okay, without MRCS, you cannot write. And you should have successfully completed a locally recognized surgical training program. For example, if you're in India, you should have done some MS or a MCH, which is equivalent to 4 to 6 years of surgical training, which should have an appropriate syllabus, and it should have been recognized by your local council. For India, if it's a Medical Council of India. So you should have successfully completed a locally recognized surgical training program, and you should provide evidence of having achieved required competency. So how are you going to give this evidence? Is through 3 references. That's all. So in these 3 references, your referees will tell that this particular candidate has achieved all the necessary competencies required as quoted by the JSCFE. Okay, so when you get a reference from these referees, there is a guide note for the referees which is given to them, and they will go through what all they need to assess before they accept and recommend you that you are eligible for this exam. Okay, and again, in these 3 references, the principal referee should be your head of the department or the head of the regional training committee, and 2 other referees must be a senior clinician who has closely worked with you in the last 2 years. Apart from that, you need to give your CV and your logbook. Now, I need to highlight on the recent changes which has happened in both the JCIE and JSCFE exams. One is MRCS mandatory. I am telling repeatedly because many candidates still ask us whether we are eligible or not. Without MRCS, you can't think of FRCS. And previously, the Section 1 exams of both the FRCS exams had an extended matching questions, but now all the questions are single best answer questions. It's MCQs and it is a single best answer questions. This is the most important thing which I want all the international candidates to look into. So if at all, if you had applied for an Section 1 exam in the international FRCS thing, which is like a JCFE exam, and by any chance, as I told you, if you have cleared a JCFE FRCS exam, that exam is not recognized by GMC for issuing your CCT or becoming a consultant in the UK. Okay, but after giving your Section 1 exam, if you think that your future career is going to be in the UK and you want to give a JCIE Section 2 exam, the committee has arranged something new. These are the new modifications which has happened. So a candidate who has cleared Section 1 exams can now give a JCIE Section 2 exam, provided they should have moved to UK, they should have worked in the UK for 1 year. In that 1 year, they should have registered for the ISCP, and they should have shown the progression of competence in the ISCP. And you should get separate references from UK consultants, and you should choose your specialty. So if you do all those things, okay, moving into UK, 1 year in UK, usage of ISCP, choosing your specialty, then you can give JCIE Section 2 exam and you can get FRCS, and that FRCS can be used for obtaining your CCT. in the UK and entering the specialist register. So these are the significant changes which has happened in the early this year in the FRCS exams. And now, previously until last year, both JCIE and JSC FE exams were called as FRCS at the end. But now, if you have cleared only the JSC FE Section 1 and Section 2 or the International FRCS, you can put INT FRCS instead of just FRCS in your name. Okay, right. So references, regarding the references, okay, when a referee gives reference to a candidate, all these things are included in his reference. So if you see this reference form, so there will be columns to tell what is your skilled, logical, analytical elucidation of your patient. So how you do this. Second is how you do your clinical examination, how you manage patients, how you manage a clinical situation, etc. So all these areas will be covered in the references where a referee must give his opinion about the candidate. And again, you need to know that. So this is the initial part of your exams. Okay, so once you fill all these forms, this doesn't mean that once you get the references, it doesn't mean that you are going to write the exam straight away. So once you get these references, you fill in this application, you send to this committee, JSCFE or JCIE. They will go through the documents and then they will tell you if they are satisfied with the references. They will cross-check the references, and if they're satisfied, they will tell you you are eligible to proceed with the exam, and then you can pay the fee for the exam and proceed for the exam. Now, going on to the exam straight away. Okay, so you have a total of 7 years to complete the total examination process. There are 2 sections, Section 1 and Section 2. Both the section, you have a maximum of 4 attempts. Okay, once you start writing your Section 1 exam, within 2 years time, you should have moved on to Section 2. Okay, if by any chance, if you have failed on the 4th attempt, you won't be eligible. Similarly for Section 2, if you couldn't pass the Section 2 exam in 4 attempts, you cannot pursue the exam further. Now, Section 1 exam. So Section 1 exam is a written exam, both for JCIE and JSCFE. The pattern is the same. So paper 1, you have 120 single best answers. Paper 2, 120 single best answers. Each paper you will be writing for it's not a write, it's a computer-based exam where you give your exams for 2 hours 15 minutes. Okay, and the pattern is same for both JCIE and JCFE. There is single answer. Each question will have 5 options, and there is no negative marking. Okay, so this is about Section 1. The biggest difference comes in Section 2. Okay, in Section 2, the UK-based JCIE exams are more tougher than the international FRCS exams or the JSCFE exams. So the Section 2 has 2 components. One is a clinical examination component, and second is an oral examination component. In the clinical examination component, you have a general surgery station and a special interest station. In general surgery station, you will have 1 long case and 2 short cases. Okay, in your special interest, when I say special interest, you would have chosen your specialty. If you're a transplant specialist, you will have 3 cases in transplant. If you have HPB, you have 3 cases in the HPB side. So again, in the special interest side, you have 1 long case and 2 short case. The long case is for 20 minutes and the short case for 20 minutes, each 10 minutes. Okay, so again, in this section, the things which you need to remember is before the COVID, how this used to happen is the clinical examination component of the exam usually happens in a hospital, and you will have real patients for all these things. So you will have 3 patients to see in your general surgery module and 3 patients to see in special interest module. During the COVID, what happened was they changed everything to scenarios. Okay, so they stopped bringing in patients, and instead of patients, they started giving scenarios and they started discussing as scenarios. But recently, again, they have changed. But the change now is they don't bring patients for short cases, but they bring only for long cases. So in the general surgery side, you will see a patient or an actor for general surgery and a patient or an actor for special interest surgery. So this is the clinical examination. And again, how it is done is you'll be going and sitting in a table where there'll be 2 examiners. Okay, and these examiners are very senior examiners, and one examiner will be questioning you and the other examiner will be marking you. At the end of the session, they will discuss and they will put scores individually, which will be computed for each candidate. So this is the clinical examination component, and then we have an oral examination component, which is 4, and each area you will be spending 30 minutes. Okay, so you have an emergency surgery trauma oral examination table, general surgery principles and clinical practice, special interest surgery, which is your specialty, and a special interest surgery basic principles, and 15 minutes of an academic paper interpretation. Okay, so in this 30 minutes, what you will do is, if it's an emergency surgery trauma critical care table, you will be sitting again with 2 examiners, and in that 30 minutes, they'll be discussing 6 scenarios. Each scenario will be for 5 minutes. Okay. Similarly, general surgery principles, there will be 6 general surgery scenarios which will be discussed with the candidate in 30 minutes. In the special interest, there will be 6 special interest small cases which will be discussed, each for 5 minutes. And in the basic principles, it is like basically basic sciences in your specialty surgery. For example, if you're a HPB specialty person, they will ask some basic questions like development of pancreas, some embryology questions, some physiological questions like intrahepatic circulation, etc. And the next 15 minutes is an interpretation of an academic paper. Okay, so each candidate will be given, which will be given 30 minutes prior to your commencement of your exam, and in that 15 minutes you need to go through this. In the 15 minutes you need to present and critically appraise that manuscript. Okay, so this is how a JCIE exam in the UK happens. Now, how it is different from JSCFE for the international candidates? Again, you have clinical examination and oral, but in the clinical examination side, you have 2 regions. Each table is for 30 minutes, so total of 1 hour. In that 30 minutes, you will be discussing 4 cases, which are 4 short cases, which you'll be discussing. Okay. Again, in the pre-COVID era, you had 4 patients in each 30 minutes, so you'll be seeing 8 patients, but now they give only scenarios. Okay, so this is the clinical examination, which focuses on everything starting from history taking, how you examine, how you plan a treatment plan, and how you investigate, and how you operate, and how you manage the complications. And then you have Viva examination, or the oral examination, which instead of 4 in the UK exams, here you have only 3, which is emergency surgery, which is for 30 minutes, general surgery for 30 minutes, trauma and critical care for 30 minutes. The biggest difference between the international FRCS and the UK FRCS is you don't have specialty here, and secondly, you don't have an academic paper interpretation here in international FRCS exam. That is the biggest difference. Now, moving on to syllabus. So what is expected for you to give this exam? Means, to be very honest, all general surgical topics starting from head to foot you need to know, unfortunately. Although the website gives a syllabus, okay, but if you go through, it includes everything as a general surgeon you need to know, irrespective of whichever country you come from. Okay, as a general surgeon, it doesn't mean that you'll get a CTVS question or a lung question or a kidney question, but as a general surgeon, what all is expected to know, you need to know. So this is what they say. Okay, so in the UK, okay, so if at all, if you have selected transplant as your specialty, okay, and you're giving your JCIE exam, your knowledge in the transplant should be at ST8. When I say ST8 level, it is equivalent to a senior consultant, okay, or a person who is ready to become a consultant. So your knowledge in your transplant should be in ST8. But if you see in the other areas, okay, in general surgery, you should have an ST8 knowledge. Emergency surgery, ST8, and all trainees are expected to have an ST6 knowledge in upper GI and colorectal. When I say ST6, it is equivalent to a candidate who is in colorectal or upper GI training for 6 years. That is the knowledge any general surgical candidate should have. And in other areas like transplant surgery, breast surgery, endocrine surgery, and vascular surgery, a knowledge of ST4 level is required. So this is the level of knowledge which is expected from a candidate who is going to appear for the exams. Now, having discussed your eligibility criteria, what you need to have, how you are going to apply, and going on through the exam pattern. Now let us move on to how you are going to prepare for these exams. Okay, so in my opinion, again, my background, I want to tell you. So I did all my surgical training from India. I did my MS General Surgery in India, and then I did my MCH Surgical Gastro from India, and then moved to UK in 2018. Initially worked as a senior fellow in multi-organ transplant in Cambridge University Hospital, and then moved to Royal Free, and recently became a consultant HPB liver transplant surgeon. The biggest difference between a surgical training or a surgical knowledge between the Asian countries and the UK is, in the Asian countries, when I say the biggest difference, it is like in terms of the exam pattern and how exams are conducted. Okay, in the UK, it is all based on guidelines. Okay, and second important thing is all this examination will be based on a clinical scenario rather than just testing your knowledge on stuffs which you need to remember. Okay, so that is the biggest difference in the exam pattern of the East and the West. Okay, preparing exams in the UK surgery exams is generally much easier and much interesting than preparing for a surgical exam in India, I would say. Okay, for section 1, in my opinion, section 1 is difficult of both the sections, section 1 or section 2. If at all, if you are a candidate who feel that your knowledge is poor. Okay, so for section 1, your knowledge should be extremely strong to clear the exams, and minimum time period required for preparing for this exam is 4 to 6 months, I would say. Okay, so there are plenty of resources available, okay, for the section 1 exams. So starting with the question banks. Okay, so these are the various question banks which is available at the moment, but the most famous and the most common ones which we all prepare, or the international candidates prepare, is the first two. So these two books are the most commonly followed books, and this higher FRCS book has come out very recently with a lot of extremely good feedback. And there are other books like the Doctors Academy book and the other one. And these two books are basically this a very good book which was designed for the AppSite exams in the US. Okay, and from the candidates who had prepared, I personally don't have any experience in these two books. When I gave my exams 3 years back, these are the two books which I read, apart from the things which I will tell you later. But these two books, from what I heard from the candidates recently, is very, very good for revising for the exam. So these are the question banks or revision notes available for the section 1. Moving on to textbooks. Okay, so these are all the textbooks which is recommended by the Royal College themselves. This is called as a companion series of books in various specialties. Okay, you have books for general surgery, hepatobiliary. So these books is something like a textbook which gives a broad knowledge on the various topics in each specialty. Again, this is a book which I would advise for anyone. But if at all, if you're a colorectal surgeon, this book is not enough. Okay, if you're a colorectal surgeon and if you're giving your exams in colorectal surgery, this surgery book is not enough. But if you're a general surgeon, for example, if you are an endocrine surgeon, studying a colorectal surgery book will give you a broad knowledge on the subjects which will be questioned in these exams. These are the textbooks which is available. Going on to starter courses, or so in the UK, there are plenty of courses around the MRCS and FRCS exams which are well recognized and which has been happening for 50 to 60 years. Okay, so there are something called as starter courses. This is something like an orientation course, exactly like what we are discussing today. So it is like a 1-day or a 2-day program where candidates will come and they will be taught about the basics of this exam, how to be smart in answering the single best answer, how do you manage your time, how do you start preparing, when do you start your revision, how you revise. So these are the various aspects covered in these starter courses. And at the moment, to my knowledge, there are these two starter courses, which is Doctors Academy course and the higher FRCS starter course, which is in the UK. Moving on to online resources. So this is something like if you have done an MRCS, you would have done something like PAS test or EMRCS, which is nothing but an online question banks where you go in, do your MCQs or the single best answer questions that will give explanations. You can track your progress. You can compare your performance with other candidates, etc. So these are the various online question banks which is available, where you can subscribe for a period of 3 months or 6 months, and you can use it for your exams. Again, in this online resources, when I gave my exams, I used eFRCS, which is commonly used by many candidates for the exams. Similarly, higher FRCS is one which is highly rated. Similarly, surgery online is also good. But there are plenty of the other things. So the thing you need to understand about Section 1 exams is, if you have given your MRCS exams, you would have noted that there will be a lot of recall questions. When I say recalls, it will be almost like 30 to 40% of the questions which you get in Part A MRCS would be similar in theme, or it might be a same question which has been asked in your previous exams. But in FRCS, you cannot expect. How many other books you read, how many other question banks you go through, you will get a completely new theme of questions in the exam. Okay, so that is why we have so many resources. Okay, and the aim of utilizing these resources is to make you familiar on what are the types of questions which they ask in the FRCS exams, and what is the difficulty level they go in framing these questions. This is all you can do. You cannot expect the same question or same. You might get very few, but in general, all the FRCS Section 1 exam will be a new, a fresh kind of an exam for a candidate who has prepared so many books. They won't have the same theme which has been prepared, which makes the candidate think whether this much of a preparation is needed. So in my opinion, for the key for clearing Section 1 exam is you should have a in-depth, broad knowledge on the various management plans and the guidelines, which is being practiced in the UK. Okay, that is what is expected. Okay, good. And there are various podcasts available for Section 1 course, which is by ASGBI, which is Association of Surgeons of Great Britain of India. There are podcasts by Royal College of Surgeons, St. Mark's, and the Behind the Knife. These are all the podcasts which are useful for you to prepare for this exam on the go. If you're driving, you can just log into these channels and you can select one of these topics and you can listen to, there are some various lectures, there are some a review about landmark papers, etc., etc. And there are Section 2 courses. This I want to add here, that candidates for Section 1 exams, okay, they, in the UK, even me, we joined the Section 2 Viva courses as an observer, okay. So all these knowledge-based stuff, whichever I have told, I feel that it is more theoretical, although it is scenario-based, it is more theoretical than the actual case-based discussion which happens in Section 2 exams. So candidates preparing for Section 1 exams, they generally tend to participate as observers in live courses which happens for Section 2 exam to get the real-time feel of the actual case-based discussions, which is usually done in Section 2 exams. Now, moving on to Section 2 preparation. So in my opinion, if you are a candidate who had spent a lot of time in the ward and who has done a lot of a logical clinical practice in your lifetime, Section 2 exam is easier. But the next important thing, which is a problem in Section 2 exam, is the time factor. As I told, within like 2 hours time, you will be discussing on 24 case scenarios. Okay, and each scenario you will be spending 5 minutes. Okay, in that 5 minutes, you should have the skill of expressing your knowledge, your maturity, your thought process, and you need to be very, very safe in designing the plan for the patient. So in order to achieve all these for the Section 2, you need extreme level of practice. Okay, almost every one of you who are here at this moment if you see, majority of you would be at least more than 5 years of surgical training. Okay, so you would have had enough knowledge to appear for this exam. But if you go through the actual technique, which is being assessed in the Section 2 exam, that is where the crucial bit is. And that technique can be achieved only by a stringent practice and recurrent practice being corrected by a mentor or a faculty. So again, Section 2 is basically clinical scenarios. If you want, ask me, Viva Books, there are 2 famous Viva Books, which is there for the last, I would say, 5 to 7 years. It has not been changed. And candidates study either this book or this book. This is a 200 to 300 page book, which gives various clinical scenarios in various specialties. Okay, so this is the basic book which I would recommend. And then most importantly, there are some online resources, exactly like online question banks for the Section 1. You have online Viva Resources where you subscribe for these websites. You go in, and instead of studying in the books, you have the same thing in your screen, and you will have access to this content for a period of 3 months or 6 months. The most important difference in the preparation of Section 1 and Section 2 is these courses. As I told you before, the key for clearing the FRCS exams is your skill in expressing your knowledge, maturity, management plan, and also managing the given time of 5 minutes. Okay, so because it is the way how you express yourself in the exam matters a lot, almost every candidate would join in 1 or 2 of these live courses which happens in the UK. Okay, so the very famous ones are Whips Cross ones and the Alpine course, which is there for more than 50 to 60 years in FRC in the UK, and there are a few other courses as well. So these courses happen like once or twice in a year in the UK. Before the COVID, these were on-site events. Now majority of which are online events, and they get taken a very limited number of candidates. And basically the course comprises of series of lectures and also mock Viva, where a faculty will be questioning the candidate and they will be answering. But these courses are extremely intense. For example, Whips Cross is for 7 days, 8 to 8 in the morning, 8 to night 8 for 7 days continuously. You will be presenting. An Alpine course is for 5 days, and if it happens once or twice a day. And almost every candidate in the UK would participate at least in one or 2 of these revision courses. And to be very honest, all these courses, all these subscriptions are all extremely costly, I would say. For a Whips Cross course for a period of a week, for you to participate, it costs around £1,300. And if you want to be an observer, it costs around £900 for a week course. Similarly, the Alpine course, they charge around £700 to £800 for a period of 5 to 7 days. So almost all these courses are a bit costly, but it is definitely worth for the money you pay, because without participating in this course and getting guidance from your senior faculties, it is very, very difficult for you to understand what is these actual exams are. And again, unless you participate by yourself and you present by yourself, it is very, very difficult for you to master the skill of Viva answering for the exams just by listening to a video or by reading the books. There is one program, the mentorship program, which is the one which we are doing. Okay, this is the only program which is available at the moment, almost for any FRCS, I would say, means for JCI or JCFE. So instead of a week of intense course in the ones which I told, what we offer is a 3-month program, where candidates will join, and the candidates will be traveling with the faculty over a period of 3 months, where we will be training them over the weekend on each specialty. For example, the first weekend, Saturday and Sunday, we'll be discussing on general surgery. The next weekend will be on critical care. The next weekend will be on HPB surgery. The next weekend will be on transplant surgery. So over a period of 3 months, you gradually practice and practice and practice. And at the end, before the exams, we conduct a proper mock exam, which is exactly similar to your actual FRCS exams, and we conduct as a one-on-one fashion, and we give the marks, etc., etc. So this is how this 3-month mentorship and a Viva program is designed by us, and we run this course thrice a year, exactly means just before the UK JCIE exams. Okay, so this is the only mentorship program which is available at this moment for FRCS. And again, moving on to podcasts, there are various podcasts, but the famous ones are Behind the Knife podcast, which I loved a lot when I was preparing. And there is something called First Incision podcast and Studying for FRCS podcast. So these are the various podcasts available for you to prepare for the exams. And there are various national organizations, which is like exactly like India, where you have IHPBA, etc., etc. We have various associations in the UK. One is the ASIT, which is the Association of Surgeons in Training. Duke's Club is for colorectal surgeons. RU Group is for upper GI surgeons. HERIC Society is for transplant trainees. Memory Fold is for best trainees. So when these people conduct, where they now and then during the year, they conduct some FRCS teaching programs where people tend to join. Either it will be a lecture, or it will be based on some technique of the exams, or it will be a mock waiver, etc. So these are the various national meetings which happens in the UK now and then, and majority of which happens online if you want to join. And so this is all the various resources available for a candidate for Section 1 and Section 2 exams. Now, the last question is, after completing FRCS, what are you going to do? Okay, so if you are a candidate in the UK and if you have given your JCIE exams, so with this FRCS, once you clear the FRCS, which is the minimum mandatory requirement for your CCT, then, and if you want to continue your career in the UK as a consultant, you need to start doing your CESR paperwork for obtaining CCT if you are an international candidate. If at all, if you have cleared an international FRCS, okay, what is the value of the international FRCS or the JSC FRCS is definitely it is going to add a very strong recognition in your CV, okay. Having an FRCS, which is probably considered as one of the highest surgical qualification any surgeon could acquire, that is one. Second thing is, by becoming a fellow of Royal College of Surgeons, you have access to large volumes of journals, etc., and you'll be having subscription to Royal College bulletins, etc. Third thing is, with the FRCS, you can come into UK with the GMC registration, and you work as a senior fellow in any of the specialty. This is for the international FRCS. Okay, again, I want to tell you that international FRCS is not recognized by GMC for offering certificate of completion of training. Okay, this is all about what I want to say, and this is the various groups. This is our various social media handles, and we have a Telegram group, okay, which is mainly focused on the FRCS exam preparation. And if you can search as PrepMedico in the Telegram group, you can join our Telegram group, where any kind of questions you have, you can ask us, and we, a group of 15 to 18 surgeons from different countries, local trainees in the UK, we are all here to help and guide you. Similarly, we have our YouTube channel, where most of these videos will be uploaded for you and your friends to refer in the future if at all you need. Okay, let me stop sharing and let me come to the meeting. Yes, so who has questions? Ledley Singh. There is Ledley Singh. Who has raised the hands? Ledley Singh is not here. Tejashwi Kumar.
Hello, sir. I just wanted you to elaborate more on the international FRCS. Post FRCS, what are the options internationally for the JCFE examination? You told that
So,
we can come there and we can secure a job. So, is it a specialty-based job or is it a general surgical-based job? What we would be getting?
So for you to, so if at all, if your aim is to come into UK to work on a specialty, you actually don't need an international FRCS. If you have an MRCS, MRCS is more than enough for you to obtain a GMC registration, come into the UK, and depending upon your years of experience, for example, if you have been doing a colorectal training for the last 2 or 3 years, you can use that experience to get a colorectal job in the UK. Okay. Say you are a general surgeon, so whichever you want. Okay. For example, there are the options to apply for a job is plenty. Okay. Let me mute you and then I will talk to you just a minute. Yeah, because it's a lot of noise. So the options of obtaining job in the UK are plenty, and it is open for everyone for them to apply. Okay. But when you apply, for example, if you don't have any experience in transplant and you see a transplant job which is advertised, you can still apply for it, and they will see. And if you write as, I mean, each job has a job description and what is the minimum criteria which is required for the candidate to apply. If you think that you fall under that criteria, you can apply for any of the job. Okay. But specifically, if you ask international FRCS, how is it useful for you? As I told, it cannot be used for obtaining CCT, but definitely if you have an international FRCS, obviously the people here who's interviewing you will know that you are a senior surgical clinician, and you would be a candidate for a senior job or a senior post, which is something like a senior clinical fellow or as a specialist registrar, rather than a junior job. So this is what would be useful. And in terms of job opportunities in other areas, for example, if you're looking for jobs in Middle East, or you want to go to Singapore, or want to go to Australia, obviously just having an Indian degree will not allow you to go there. But if you have an international FRCS, of course, it increases your strength of your CV like anything, and it opens up lots of job opportunities. That's all I would say. Did I answer your questions?
Yes, sir. Perfectly. Thank you so much.
Thank you. Thank you. Dr. Singh, are you there? Ledley Singh?
Yes, sir, I'm there, sir. Sorry.
Yes, tell me.
Yes, sir. So currently, I'm pursuing pediatric surgery as my super specialty. I'm interested in a job in UK. I wanted to know what would be my scope in my field, per se.
See, as I
Because
told,
all the super specialty that you spoke about, I couldn't find anything from mine. So
yeah. So because in the UK, general surgery FRCS includes only these specialties, okay, which is upper GI, colorectal, HPB, transplant, endocrine, and vascular. Okay, you have pediatric surgery as well. The good thing in the UK is all the centers are subspecialized. Okay, if you take pediatric surgery in the UK, there are only 4 or 5 units which does hardcore pediatric surgery. Okay, so means, as I told, for you to get a job in the UK in pediatric surgery, the basic requirement is you need a GMC registration. Yeah. So for getting a GMC registration, you have various routes. One is, as a surgeon, if you have an MRCS, that will pave you to get a GMC registration. The second is writing a PLAB exam, which I think for your seniority, writing a PLAB exam won't be suitable. Third option is there is something called as a medical training initiative, which is called as an MTI program, which is devised by the Royal College, all the Royal Colleges, Royal College of Surgeons, obstetricians, orthopedics, etc. So, which is basically, it is mainly to bring in surgical trainees from developing countries to a developed country like UK, train them for a period of 2 years, and then send back. This is a program for which you don't need an MRCS, you don't need an FRCS, nothing. You can come here, train yourself in whichever specialty you want, whichever field you want, provided you have that available slot. You work and go back. Okay. But if you have a GMC, you can, as I told, you can apply for the pediatric surgery job, which is open in the website, and you apply for the interview. And if you are shortlisted, obviously they'll go through your training in the pediatric surgery, and if they are convinced, they would offer you a job. And obviously, when you go up, you give an FRCS exams in pediatric surgery and move up. Is that clear, Dr. Singh?
yes, sir. Thank you so much, sir.
Thank
That was
you.
really
Thank
helpful.
you. Thank you. Jitan Kumar?
Good evening, sir.
Good evening.
I am a senior general surgeon. Right now, I am practicing as a laparoscopic and bariatric surgeon. I am practiced since more than 20 years. I have two questions. First one is I am seeking for something like without exam category, FRCS. Would it be helpful for my future career? And second question is, you had already answered for MTI, but my question is specific. I want to get MTI in either bariatric surgery or in robotic surgery.
Yeah.
Can I get it?
Yeah. So first, let me answer your second question. So how this MTI process works, okay? So step one, what you need to do is if you search as Royal College of Surgeons, RCS MTI, okay, it will lead to a thing. Okay, there is an application which you need to fill. Okay, once you fill up, and it gives so many preferences on what specialty you need, which locality you need. Okay, you can choose which kind of, and you can prioritize which place you need in the UK. Okay. The good thing in the UK, as I again told, is there are various very high volume bariatric units. There are various very high volume robotic units. Say if you want to do a laparoscopic esophageal surgery, there are very high volume upper GI units. Okay. So you can get in touch with people here. You can know where you want to put, and you can prioritize it. Okay. And the shortlisting of MTI application happens only once or twice a year. If you apply this year, you will get a job probably next year. Okay. And to my knowledge, almost everyone gets a job because any day there is a lot of vacancy in the UK. Lot of vacancy. Okay. But the important crucial bit with MTI is not all hospitals have an MTI spot to offer for an international candidate. Okay. So majority, say for example, if you take transplant surgery, because I know if you say the entire country, King's College alone has 1 or 2 spots for an MTI candidate. No other place in the UK has a spot like that. Okay. So similarly, if you take your bariatric, there are plenty of units which can offer it. And again, this is not fixed spots. For example, when I tell you this is not fixed spots, which is listed like, say, for example, Whittington Hospital, they have 4 spots, of which 2 is for MTI. It is not like that. Okay. If by any chance, say, I am working in a particular hospital, and if you're so much interested, okay, and you think that you are too senior to give your MRCS exam or this one to get this, okay, you can straight away approach us. Okay. You send your CV and you can tell us what is your aim and stuff. And we can think in what way we can facilitate you to bring to us, get trained and go back. Okay. So here there are 2 options. One is an MTI program where we will tell that we are happy to offer an MTI spot to you, and the Royal College will give a 2-year temporary registration for you, and you come here in a the visa is called as a tier 4 visa, which is like a training student visa. Okay, you come here for 2 years and then go back, which is a temporary registration. The other route which is still possible is if we think that you are a very senior renowned person and you come with a lot of recommendations, and with no doubt which we think that if you are an excellent clinician, we can straight away write to the Royal College telling that he is in part of an ST3 plus trainee in the UK and kindly provide him a permanent registration. We can even give a permanent GMC registration for you, which will make you to get job anywhere in the UK. I know plenty of candidates, especially in transplant. For example, candidates working in big units like CMC Vellore or AIMS or Amrita, where they have tie-ups with different hospitals here. Candidates coming from these institutions, they are recognized straight away by the faculty here, and they get a full GMC registration and they can get a job. So these are the options for MTI and this one. Okay. What was your first question? Sorry.
Examination, FRCS in without examination category.
So that is still there. That is still possible. But again, it is called as an honorary FRCS. Okay. So having an honorary FRCS will allow you to get GMC registration through honorary FRCS and will allow you to obtain jobs, etc. That is not a problem. Again, there is a separate application form for this. okay, and
Okay.
it needs to be recommended by different people, okay, and few of them should be in UK, few from your place,
Okay.
and it's a process. And again, there are a lot. If you attend one diplomat ceremony in the Royal College, there will be 1 or 2 candidate per session they give. For example, in a session, if they give, say, 100 FRCS the certificates, of which 1 or 2 would be a honorary FRCS. The rest all will be this. But it's still possible if you think that you are a very senior person in your field, having achieved many things. If you see the people who have got this honorary FRCS, they are all very, very senior people and well renowned in the field, having done a lot of achievements in the field. Yeah.
Correct. Can you help me out for either of the things?
So what you can do is, no problem at all. Okay, I think we would have sent you an email. Okay, if you can send us back an email, I will send you my personal details to you, and we will have a chat and we'll discuss what we can do. Okay.
Sure. Thank you so much.
No problem. Khalid, can you unmute yourself, Khalid?
Good afternoon, sir.
Hi, Khalid. Tell me.
Sir, I have done my international FRCS Section 1 in 2017. And after that, I once appeared in Section 2 in Kuala Lumpur, but unfortunately couldn't clear it. So there is a 7 years. In 7 years, we have to qualify Section 2. But in COVID era, there was a break in the examination. So what are they planning?
So again, this 7 years rule was put up and it is there for many, many years. Okay, many years it's been there. But the biggest problem with the international FRCS is during the COVID time, they didn't conduct the exam for a lot of time, and they didn't have an adequate manpower to even conduct Section 2 exams at that point. That was one of the important reason why they had given the option of you to moving into JCIE Section 2, which happens regularly in the UK. Okay, so given the fact that the exam itself didn't happen and because of COVID, they should be a bit lax on it. Okay, they will detect those many years in it, but I would advise you that it's been already 6 years for you. I would advise you to take up the next possible exam ASAP and give your exams. That's what I would say.
Thank you, sir.
Have you applied for your exams?
No, not yet. I received an email a few days back. They have asked, they are planning for the exam, and they have asked for the choices of the countries, because in the last year they conducted the exam in Malta, the international FRCS. Initially, the 3-4 exams they conducted in Kuala Lumpur. Before that, they conducted in UAE. Now they have asked for the options, candidates to give priority-wise option. They had the option of this year UAE. Kuala Lumpur.
I think in November you have exams. I think in November, there are plenty of exams happening.
Yeah, I have not applied. The date is closed for November. I have not applied for that. But now they are planning either in UAE, Kuala Lumpur. There was Cairo and Sri Lanka. 4 options.
Fine. All right.
Thank you, sir. Very informative lecture. Thank you.
No worries at all. And this video will be available in our YouTube section. And as I told you, please join our Telegram group or whatever things we have. And as I told, we all came from how you are now. Okay, we all came from India, moved here. We almost explored all the options, and we are giving it back. So don't worry at all. Okay, we are happy to help. Right, Tejashwi Kumar.
Yes, sir.
Yes. Tejashwi, you have raised your hands.
I just asked my question. I'm done.
Oh, okay, fine. No problem. Thank you.
Sorry.
Thank you. No problem. Eugene Ma.
Hi, evening, Mr. Mani.
Hey.
Thanks for a very informative talk. I am from Malaysia. So I've recently cleared my part 1, but I applied it under JSCFE. So having given the information online and by Mr. Mani also, there is an option to switch to JCIE. The only thing is because for a Malaysian system, pardon me, just give me 1 minute to explain my situation here. Because in Malaysia, we don't have a direct specialty training straight to ST8. What we have is a 4 years locally trained program, local training program where I think it's approximately equivalent to ST6. Then subsequently, we are allowed to practice independently as a specialist, as a surgeon. Then if we wish to continue to subspecialty training, then after about 2-3 years, which I have already 2 years of independent training, then we apply for another 3 years of subspecialty training. So would like to ask, because since I passed my JSCFE section 1, if I were to switch to JCIE, means that because in that subspecialty training, I need to spend 2 years of training locally, and the third year will be spent in any overseas country of my choice, which of course include UK. So that would be ideal if I were to go to UK for that 1 year and get the referees and all the required. But considering that there's another 3 years away for my section 2, is it advisable to do so? Because hardly any surgeons here sit for JCIE, because it's either they have the qualification and they stay in UK, or they just take the JSCFE.
Yeah,
what do you think?
I feel that if you're not planning your future career in the UK, when I say career in the UK as a consultant in the UK, that's what I would say. Okay, for becoming a consultant in UK, you should have a CCT in the UK, and you should be in the specialist stage. So if you're not planning that, waiting for 2 years and trying to get this again, although it is a minimum of 1 year is what is recommended, this doesn't happen in a year. Okay, for example, if you come and work under me in my hospital, 1 year is not enough for me to assess you, know in depth about you, to tell that he or, because when I give a reference to you, I take up the responsibility for you, telling that he is equivalent to an ST6 level. Okay, so you don't need to worry much about your subspecialty training. When I say the subspecialty training in that specialty, it doesn't mean that it should be a named subspecialty training. Okay, as long as you, for example, if it's a colorectal, as long as you have been doing colorectal surgeries in those period of whatever name it is, that is fine. That is good. They don't look into whether it is a named program or an unnamed program. That is not a problem. But you coming into UK, choosing a specialty, getting everything, it is, I think if you don't plan to come into UK as a consultant and settling down here, I don't think that is a wise decision. It is an extremely long time-consuming process. Again, with the doubt of a success. You might do everything and they might tell that we cannot give you also. We don't know.
Yeah, correct. Because I was thinking the longer, the bigger gap between section 1 and section 2 actually is more difficult to sit for the exam.
Yeah. Means again, I would say just apply for the part 2. Okay. And just do at the earliest again. That's what I would say. Because now the trend which I am seeing is the international FRCS is a kind of exam which many of the surgeons weren't even knowing, at least until 1 or 2 years back. Now everyone wants to give international FRCS. The reason being means having, and so now people want to move out to different countries, especially to Middle East, Singapore, and those areas. They don't accept any of the surgical training done in Asian countries. They want either an MRCS or an international FRCS or an FRCS or a CCT from UK for them to, so everyone wants to do that. So the thing is, and again, if you see the number of candidates waiting for a section 2 exam and the number of exams which actually happens, is we can't even match that. Okay, so what I would advise is wherever you get, okay, don't worry about traveling. Okay, even if you get in Malta or UK, or you go on this side, wherever it is, try to capture a place, go and finish your exams. That's what I would say.
All right, thank you, sir.
Thank you. Spurti Shudhakar Shetty.
Hi, sir. Thank you for the very informative session. I'm actually general surgeon trained in India, but for the past few years, I've been only doing breast surgery, and I've moved to UK in the last 1.5 years.
Okay.
I'm trying the Caesar route. For the Caesar route, you were telling about the evidence. So the logbook, are you mentioning the logbook from our general surgery time, which is like 10 years back for me? Or is it just the recent breast surgery logbooks? Is it enough?
So
or?
Caesar means you are asking for Caesar or the FRCS breast surgery exam? What are you asking for?
For Caesar, I do need a exam cleared. So
yeah, for the FRCS breast surgery exams, okay, that
mhm.
is completely different, where you need to give a logbook of the last 3 to 5 years. Okay, minimum 3 years is what they ask for. Okay, but
Okay.
majority of the eligibility for you to write the FRCS exam is based on the references you get. Okay, so you don't need
Okay.
to worry about that there. But Caesar is a completely a different process, and it not
Mm.
only includes your logbook, but it has plenty of other things. Okay, as
Mm.
I told, the logbook is required for the last 6 years alone, unfortunately. Okay,
Okay.
in the last 6 years, you should have done all the surgeries in terms of numbers as
Mhm.
quoted by the JCST. Okay, for example, if you need to have 50 lap appendectomies or appendectomies in the last 6 years, you should have done 100 hernias, you should have done 50 emergency laparotomies. So those, there are some minimal mandatory things which you need to have in terms of numbers, and those numbers should be in the last 6 years. The second
Mm.
important thing is you need to do all the other competencies, which is like CBD, CEX, and then you need to have 3 or 4 appraisal meetings. There are
This is
plenty
for
of,
the Caesar, right?
this is for
You're talking.
Caesar. This is for
Yeah.
Caesar to obtain CCT. Okay. There are
Okay.
plenty of other things. First step is you need to register in ISCP. The
Yeah, I've
second step.
registered in
Mhm,
ISCP. I'm
mhm.
doing all the details, CBD and stuff,
Perfect.
audit and
Mhm,
research and all that. The only
mhm.
thing is about the exam, because I've been in breast surgery for the past 10 years.
Yeah.
My general surgery was before that. So lap appendix, hernia, all that, I've done it, but long back.
Exactly. So
So
that is the biggest problem for a non-trainee when they come into UK. Okay. Unfortunately, how people tend to do is they try to do some general surgery locums. Okay.
mhm.
And try to get those numbers. There is no
Okay.
other shortcut for that, unfortunately. There is
Okay.
a different Caesar, okay,
Uh-huh.
which is specific for certain specialties. Okay, like
Okay.
which the success rate I am not sure, but I can
Uh-huh.
help you. Okay, you can send me an email and we can discuss on that further. Where do you work?
I work in Maidstone and Tunbridge Wells.
Okay, fine, good. So there are some kind of Caesar which is specific for certain specialties, which includes breast as well, luckily, and
Okay.
transplant as well, where
Okay.
they say that if you think that means in the clause they have put, if you think that you don't need the other numbers which is required for CCT, there is some special route, which is a specialty route, which you can apply, where it is you will get a CCT in breast surgery, where when a general surgeon gets a CCT in general surgery, which is whatever it is, it could be breast surgery, transplant surgery, or whatever, there are specific ways to get a CCT in breast surgery, CCT in transplant surgery separately, but that's a different process, and this is chosen according to the website based on case by case basis.
Okay.
Yeah.
Okay.
Yeah,
Okay.
but happy to discuss on this and guide you further. Okay, just
Yeah,
keep it.
I'll email you. Thank you so much.
Sure.
Thank you.
Any other questions, guys? Anyone else? Fine. So as I told, I hope I covered everything related to the FRCS exams, and most importantly, all the queries which you have in the FRCS exams in terms of MRCS is needed or not, what is the eligibility, how to change, etc. All this has been addressed. Okay, and as I told, we have been involved in training candidates. So anyone who needs any kind of support in terms of your exams, be it section 1 or section 2, do contact us, and we are much happy to help you all. Okay. Hope you all had a great time, and thank you so much for attending this webinar, and see you all soon in some other forum. Thank you so much. Thank you.
Thank you.
Thank you.
Thank you.